Hello and welcome to the beginning of your new joint replacement experience. You've already completed the hard work of choosing surgery, received medical clearance, and obtained the necessary imaging. Please take some time to watch this video to ensure you're prepared for a successful outcome. We'll cover several important topics including what to expect the day of surgery and after, wound care, prescribed medications and how to take them, physical therapy, and several others. There's quite a bit of information in this video. I do not expect you to remember all the details up front, so it is important for you to reference this video after your surgery as a guide to assist you in your recovery and to ensure you have a great outcome. Let's get started. Day of surgery. You will get a phone call the day prior to your scheduled surgery describing directions to the facility as well as what time you should arrive. We typically ask you to arrive 2 hours before your scheduled surgical time to ensure you can check into the facility, get changed in the appropriate attire, fill out medical paperwork, and receive pre-surgical medications. The day of surgery, you will meet the surgical nursing team as well as the anesthesiologist who will confirm your surgical and anesthetic plan. Most patient surgery lasts about an hour. You will typically get up and walk about an hour after surgery and are discharged home within 2 to 3 hours. You will work with a physical therapist in the facility to ensure you understand exercises to perform at home and to make sure you're able to walk independently and safely. You will also receive instructions from a nurse describing how to take your medications and care for your wound, which after receiving our printed instructions and this video, you should be ahead of the game. Common experiences after surgery. After surgery, it is very common to experience pain in your joint. Surgery is controlled and precise trauma to your body, and your body reacts to surgery. Patients typically experience pain and swelling in the joint, and it is very common for the leg and even foot to swell over the coming days after surgery. Bruising is also very typical that can extend down the leg. Your wound is closed with sutures and dressed after surgery. However, bleeding into the dressings is also very common. Typically, surgical bleeding stops after 3 to 5 days from surgery. Nausea, upset stomach, and constipation are also very common after surgery. This is due to effects on your body from anesthesia as well as side effects from the medications. We prescribe medications for upset stomach, nausea, and constipation, so please be diligent in taking these medications. For constipation in particular, you may also take any over-the-counter or home remedy aids you find beneficial. Many patients find medications such as milk of magnesia or prune juice are very helpful. If you have any questions or concerns, please don't hesitate to reach out to the office. Our team is very experienced and will get back to you the same day with any concerns you may have. Wound care. For knee replacement patients, your knee will be dressed with sterile gauze and an elastic bandage. 3 days after surgery, you may remove this and you will notice an adhesive bandage on your incision. This should remain in place. You may leave this in place and shower. We will remove this bandage at your first post-surgical appointment 2 weeks after your surgery. If you have received collagen, you will remove this adhesive bandage 1 week after surgery and begin daily collagen dressings. For hip replacement patients, you will have 2 wounds. You'll have a small wound on your opposite hip that will have a dressing you should remain in place until your follow-up appointment. The wound on your replaced hip will be dressed with a clear waterproof film with sterile gauze underneath. You will leave this in place and may immediately shower. We will remove this dressing for you at your first post-surgical appointment 2 weeks after your surgery. If you've been approved for collagen, you will remove the outer dressing and gauze as well as the white adhesive strip 1 week after surgery and begin daily collagen dressings. If at any point your surgical site is saturated with blood, the dressings get saturated with bathing, or you have any concerns, please call the office. Medications. You will be prescribed several medications to assist in your recovery. To prevent a blood clot, we typically use 81 milligram aspirin that you will take twice daily beginning the day after your surgery. You will take this for 30 days. We also prescribe a drug called tranexamic acid. This drug is designed to decrease surgical bleeding inside your joint. You'll take this medication 3 times a day for 5 days. This medication also begins the day after your surgery. For swelling, we prescribe an oral steroid pack. This drug should come with instructions from the manufacturer. You'll take this drug beginning the day after surgery and take it until the pack is complete. To prevent an infection, we prescribe an oral antibiotic. You'll take this medication twice a day beginning the day after surgery. We give you a week's supply of this. For upset stomach, nausea, and constipation, we prescribe 3 different medications. These medications are not required, however, these symptoms are fairly common, so please take the medications as prescribed if you experience these symptoms. And lastly, we prescribe several medications for pain. Pain is very common after surgery. The goal of the medication is not to take all of your pain away, but to keep it under control. We typically use celecoxib, Tylenol, a muscle relaxer, a non-narcotic pain medication, and finally a narcotic. The muscle relaxer and narcotic can make you drowsy, and the narcotic does have addictive properties, so we advise you begin with the other medications first. We ask you to begin first with celecoxib, Tylenol, and the non-narcotic pain medication called Jornavix. If you're still experiencing pain, you should then take the muscle relaxer and finally the narcotic. If you have any questions regarding how to take the medications, you will get a phone call the day after surgery, and we'll check in with you and make sure you understand the medication regimen. Physical therapy. I cannot stress enough to you the importance of physical therapy on your outcome. Besides what we do in the operating room, this has the most impact on your outcome. Therapy is hard work and nobody but you can do it. Medications and the physical therapist are designed to help you, but ultimately it is your responsibility to achieve strength and range of motion. Typically, physical therapy will be 2 times a week. It is very important that you work on your own at home the other 5 days. For hip replacement patients, physical therapy will help you stay strong and walk independently. It is important to walk as often as you can to prevent blood clots and maintain your strength. Physical therapy will help you get off your walker and transition to a cane and eventually no assistive devices at all. This process typically takes 2 to 3 weeks for most patients. For knee replacement patients, physical therapy will help you achieve full range of motion as well as strength. It is very important you understand you must work through pain to achieve full motion in your knee. The faster you can achieve your range of motion, the better you will do both short and long term. My minimum goals for your range of motion is the ability to fully straighten your knee and bend it at a 90-degree angle by 2 weeks after surgery. If you have not achieved these goals, we will have a discussion at your 2-week visit and typically will require you to attend physical therapy 3 to 4 times a week to ensure you do not fall behind. By 6 weeks after surgery, you should have the ability to bend your knee to 120 degrees. These goals ensure you will be able to use your knee for most of life's activities. Medical equipment. We offer medical equipment to assist in your recovery after surgery. For both hip and knee, this includes a brace that provides stability and also provides compression and application of ice to your surgical site. We also offer a cold therapy machine that circulates cold water to your surgical site to decrease pain and swelling. And finally, we offer sequential compression sleeves to assist with swelling and prevention of blood clots. My team will instruct you in the use of these devices. Follow-up visits. After surgery, we routinely see patients 2 weeks and 6 weeks after surgery. This will be with either myself or my physician assistant. These visits' purpose are to make sure your wound is healing appropriately, you're achieving your physical therapy goals, and you have plenty of medication. We will also take x-rays at these visits to ensure the implants are stable. My staff will also assist you with any medical leave and return to work paperwork. It is important to be in communication with them about your experience and the need with the specifics of your job. In conclusion, I want to personally thank you again for choosing me and my team to assist with your joint replacement. If you invest in your outcome by following our instructions and plan, we expect you to get back on your feet and back to life quickly. Best regards.